All right. Hello, everyone. Today I was going to talk about this paper that came out late last year that was about the evaluation of urine dipstick protein to urine-specific gravity ratio for detection of proteinuria in dogs and cats. I kind of got interested in this because we were trying to do a retrospective study, and so I was trying to see if you could actually use this to estimate proteinuria when we didn't have UPCs, which is how I got into looking at this article. Okay. So some of the background for this article is that I think most of us know that first-line detection of proteinuria is commonly accomplished using urine dipsticks as part of the urinalysis. It's semi-quantitative using the bins type thing, so there's a lot of overlap between categories, and it's maybe not the most accurate, but it has the greatest sensitivity for albumin over some of the other types of proteins. And there are a lot of things that, or a few things that can cause false positives or false negatives that have been reported, including dilute urine, non-albumin proteins in low concentrations for the false negatives, or the false positives. There could be things that are causing discoloration to the urine since it is a colorimetric pad, really alkaline urine or highly concentrated urine. And then this is just some more background where this was the first paper that showed that UPC has been pretty highly correlated with 24-hour urine protein excretion. And UPC is recommended when persistent proteinuria is detected on urine dipsticks, and it's kind of our gold standard test. And then what about urine-specific gravity and its relationship with protein and kind of what's been looked at with that? So this was a paper that came out, I think, last year that was looking at the relationship among UPCs, urine-specific gravity, dipsticks, and bacteria in canine samples. This was a retrospective study of 394 dogs. And so what they did is they did non-negative dipstick categories. So this graph here would be trace, and then B is 1+, 2+, 3+, 4+. So they divided them by the dipstick category and then looked within each of the dipstick categories how well the UPC ratio and urine-specific gravity based off that dipstick category were correlated. They did find that it was statistically significantly correlated, but it was relatively weak, where a lot of the R values were like 0.4, 0.5. And they were trying to see if they could come up with a way to predict what the UPC would be based off the dipstick protein and the urine-specific gravity. And their conclusion was that they weren't able to reliably predict whether a UPC would likely result in an abnormal finding, so greater than 0.5 when the specific gravity and dipstick categories were known. And then one of the other papers that looked at this came out in 2010 that was looking at urine dipstick for confirmation of proteinuria, and they looked at these where they categorized them by different urine-specific gravity categories and then did sensitivity and specificity of the dipstick within those specific gravities of being able to predict the UPC. And the sensitivities and specificities of the urine dipstick for the detection of protein varied pretty widely depending on which group of urine-specific gravities you were in, indicating that urine-specific gravity may affect our protein concentrations when looking at dipsticks. And so really what this study, knowledge gap-wise, was trying to fill in was, people then started to say, well, can you use protein to urine osmolality ratio? Had been proposed in human medicine as a convenient way to estimate proteinuria. And in some of those studies in people, they found that if you had that ratio was greater than 2.5, they were able to identify people with renal protein loss in excess of 3 grams in 24 hours. But there's not very much data evaluating the performance of that type of ratio for proteinuria in veterinary medicine. There has been one paper published, I think in the last 1 to 2 years, which was this paper, that did use a urine dipstick to USG ratio to estimate urine protein content. And they used a cutoff of greater than 1.5 for that ratio, which represented a 1+ proteinuria with a urine-specific gravity of 1020 as being an abnormal protein content to identify patients in that study with proteinuria. That's really the only paper that I could find looking at it. So the objectives of this study were to evaluate the correlation between the urine dipstick protein ratio and UPC. They also wanted to evaluate the influence of some of the physical, chemical, and sediment properties of a urinalysis on this relationship. And then they wanted to assess the performance of this ratio in detecting proteinuria based off IRIS guidelines using UPC cutoffs, and then assess the performance of that previously published ratio cutoff of 1.5 and its capacity to detect proteinuria in samples. So this was a retrospective cohort study that went back, and the population used for this study were medical records from Iowa State University between August 2016 to August 2021. They included dogs and cats that had a urinalysis, urine culture, and UPC performed, where all of those tests had to be performed within a 24-hour period. They excluded patients that had incomplete medical records or greater than 24 hours between submission of any of those urine tests. The data that they collected included signalment, urine culture results, urine collection method, urinalysis results, and the UPC. And then for their data analysis, they did dipstick to USG ratio, which was calculated using the formula that was used in the previous paper. So the dipstick protein in mgs per deciliter minus the urine specific gravity minus 1 times 1,000. So for example, if you had 30 milligrams per deciliter with a urine specific gravity of 1015, you would get a ratio of 2. So their study population for this study included 308 canine samples and 70 feline samples. So some of the characteristics were that based off the dipstick protein ratio, which is here, which showed all the different categories and how each of the dog samples and cat samples were classified. And what you can see is the vast majority of the samples had trace or higher protein levels. So it was 97% of dogs and 94% of cats, so not very many that had negative results. And then based off IRIS guidelines, if you were using the UPC results, this gives you the classification of how those were broke down. And you can see that the vast majority of them would have been considered borderline proteinuric or proteinuric based off the IRIS guidelines in both the dogs and cats, but it was 50% of the cats and then 83% of the dogs. The urine was predominantly collected via cystocentesis in 75% of the dogs and 83% of the cats. And only a very small number of patients had glucose in their urine, which was about 8 to 10% in dogs and cats. And about 20% of the cats and dogs had what was considered an active sediment. And then only about 14% of dogs and 7% of cat urine samples were positive via culture. So one of the main objectives of the study was to evaluate the correlation between the dipstick ratio and the UPC. And so these are the graphs. So the one on the left is the canine samples, which has the UPC results on the x-axis, and then on the y-axis is the dipstick protein result. And they did find that there was a significant correlation between the two, but it was pretty weak with an R value of 0.5. And the cats had similar results as well, with the same setup with their graph over here, where the R value is 0.47 for the cats and was significantly different. They did go ahead and look at some of the urine characteristics as well to see what impact that would have on this correlation, and it did not differ in the dogs based off the presence of an active sediment or the presence of glucosuria, or when they looked at different groupings based off urine pH. And then in the cats, they also looked at those similar urinary characteristics to see if that would have an impact on this correlation between the dipstick ratio and the UPC. And it did not differ based off the presence of active sediment, glucosuria, or when grouped based off urine-specific gravity or urine pH. And then one of the other objectives of the study was to assess the performance of this ratio in actually detecting proteinuria based off the different IRIS guidelines. So this is the ROC curve here, and this is the dogs. And then this is the table that kind of goes along with that, that shows you the different UPC cutoffs that they use, the area under the curve, and what the optimal ratio cutoff that they found with sensitivity, specificities, positive predictive value, and negative predictive values. They found that the optimal cutoff of 1.4, which is close to what that previous study used of 1.5 as the cutoff, was pretty good sensitivity and specificity for detecting proteinuria, and it had a pretty good positive predictive value. The negative predictive value is not quite as good. And then for cats, this is the ROC curve from the kitty cats as well, and their area under the curve with the different UPC cutoffs based off IRIS guidelines, and they had different optimal ratio cutoffs of 1.2, 2.1, or 2.8, depending on which thing you use. The sensitivity was not quite as high in the cats. Specificity was pretty good, and it had a pretty high positive predictive value, but a lower negative predictive value. So really what the study kind of showed was that the dipstick to urine specific ratio optimum cutoffs had a pretty high positive predictive value, which was meaning that a positive result is suggestive of urine protein loss, and that further testing is warranted with UPC for quantitative measurement. The negative predictive values were a little too low to allow for exclusion of non-proteinuric patients. And then the detection of the severe proteinuric group with UPCs greater than 2 had lower positive predictive values, and it couldn't really accurately identify patients with severe proteinuria. Some of the limitations of this study included the criteria where they had to have a urinalysis and UPC to be included in those patients. So that kind of biases towards running all of those tests on a patient. So the patients were probably more likely to have proteinuria, and they had a really small number of patients that were dipstick negative or considered non-proteinuric based off UPCs, particularly in the dogs, which so we might get different values if we had a population that kind of expanded more of the different ranges for protein levels in the urine or no protein levels in the urine. It was retrospective, and the medical histories were not really reviewed for factors that could affect the dipstick results. So things like medications or other things that could have an impact on it were not really reported or looked at, which could have an impact on why the correlation between UPC and dipsticks maybe was not as high as one would think. But really what I took away from this is that the dipstick USD ratio, it could be used as a method for identification of dogs and cats with clinically relevant proteinuria, indicating that you should have a quantification via UPC. It could not reliably exclude patients with proteinuria, and it cannot replace the UPC for quantification of proteinuria. I don't know that it really changes what I do in clinical practice, because I feel like if just based off the dipstick, they had protein on it that was persistent, I would do a UPC. So I'm not sure that the ratio is super additive to that. I think it potentially could be helpful for some retrospective type studies where you may not have that data potentially. So that was pretty much what I had for this paper. It's a pretty simple paper. I don't know if anyone else has thoughts or suggestions with this or other ideas. JD, I know you presented something at ACVM looking at this ratio. Was your data similar to this? I couldn't find the abstract when I was looking online. I feel like this is a very quiet group. Well, Summer, I think this might be the shortest journal club ever.
Well, I'm not sure if Dr. Foster is on or not. He's logged in, but I think maybe he had patients that he was attending to and had just logged on. But if you're all done and nobody else has anything further to add, I guess we could just go ahead and end it. But that it's honestly going to be up to you, however you want to proceed.
Yeah, I don't have a lot else to say. It was a pretty simple paper, unless people have discussion or other things they want to talk about. feel like we're just going to sit here and stare.
No, then that's fine. Then we will just go ahead and end it now then.
Okay, that sounds good. I hope everyone has a great day.
All right. Thank you.
Bye.
Thank you.